Why did Belinda travel from the UK to California for her back pain when nothing else worked? Watch her story. You know, my initial thoughts with Belinda coming in, she doesn't want surgery, she's 17. And I'm looking at the MRI, again, you can't judge the MRI, but I'm looking at it where there's an L5-S1, it's extremely dehydrated, and there's a very large protrusion. Just looking at it on one view, it's probably about a 1.2 centimeter. But the thing is, it does make me nervous because thinking of Jeff had like a 1.2 centimeter, Ilham had a 1.0 centimeter. So I'm very familiar treating these types of conditions. So I felt comfortable saying that we could help. Now, it's all based on the physical exam. So seeing the image is one thing, but then when I test them, and A, is that the cause? It's most likely the cause because that's what she's experiencing. So most likely, but we'll confirm that. But B, is the decompression going to be safe? So when I pull her and create space manually, is it hurt or does it increase her symptoms? That's one thing I'll check for. Most of the time it doesn't happen, so it's safe. Number two, we'll take flexion extension films. So we'll evaluate how she moves or how her spine moves with flexion and extension. So it will give me some insight clinically on maybe an angle to use. Like for example, if she leans on extension, if she leans back, and her L5, remember the L5 on the S1, if it slides backwards just a little bit, stable or unstable, if it collapses more than I'd like to see, that might say that we have to go more flexion on the table, more flexion. So it helps give me insight. Okay, this is the MRI that we're looking at. This is a T2, so we have sacrum here, L5, L4, L3. You can see the annulus there. There's the inside the nucleus pulposus here. There's L4, you're seeing a little bulging. Here's the protrusion. It looks to be about 1.2-ish centimeters, completely blocking all the nerves. That's her problem. So when we do the testing, I'm gonna see if we can get it to reduce. On her x-rays, this is a back to front view. This is her left side. This is her pelvis, her hips. Look at the spine, the curvature. The spine's adapting to release and take pressure off this nerve. That's the sciatic nerve that goes down her leg. When we take a lateral view, this helps us decide the angle for the decompression table. Here's the curvature, here's the disc space, here are the discs that are involved, and this is the nerve that goes down her leg causing sciatica. When she flexes forward, it gives us insight to the angle of the table, and furthermore, when she leans backwards, it crushes these nerves. We're here with Belinda.
Hi.
What brought you to our office?
Oh, just back pain all the time.
Where are you traveling from?
The Isle of Man.
What's the one thing you look forward to doing again that you can't do?
Literally any sort of exercise.
Any sort of exercise?
Yeah.
Belinda's coming for her third day of treatment. It's amazing. The first day, she's had no more numbness. So she came with numbness in her left thigh. That's completely gone. I'm just making sure that the angle is appropriate. So on the table, we can change three things. The angle of the table, how much weight we're pulling with, and then also kind of like the oscillation, how it patterns. I like the angle so far. We're seeing how much weight she can tolerate. And then the oscillation cycle is pretty good, but that's what I'm looking for as we see her for the third day. We're already seeing the numbness is gone and her left chronic 2 years lower back pain is significantly reduced. That's what I'm looking for. All right, day 3. You can see that's a very precise angle here. And there's the pull. That's it right there, the table right there. All right, we're here with Belinda. Belinda, you've done 5 days in our program. Tell us, how much better is your back and your leg?
So much better. I've had no numbness in my leg and all the pain in my lower back's gone. It's completely gone.
It's gone? In 1 week? Yeah. I guess it works?
Yeah.
Day 7 since Belinda flew from the UK to get decompression and our disc renewal therapy. So listen, she had lower back pain, numbness down her leg for 2.5 years. In 7 days, the numbness is completely gone. The low back pain completely gone. Now we're strengthening her back so it doesn't come back. We decided that in 2 weeks, we're gonna get a follow-up MRI. So we're gonna see the change in the disc size in just 3 weeks of our disc renewal therapy. I'm so excited for Belinda. She's 17, 2.5 years of pain, facing surgery, and already pain-free in our decompression program. So listen, if you want to see more of Belinda's story, we're going to post a new video. Follow and subscribe. Make sure you pay attention to how she's doing.